Good morning, everyone. Thank you for joining us for today's webinar, COVID Crisis 2.0, Tips to Help Businesses Address New Cases, Mask Mandates, and Vaccine Requirements, presented by Rea Associates and Critchfield and Johnston. The attorneys of Critchfield and Johnston, LTD, have prepared the content of this webinar for informational and educational purposes only. It does not constitute legal advice and is not intended to create an attorney-client relationship. Further, your participation in this webinar does not create an attorney-client relationship. Participants should not only act upon any information presented in this webinar without seeking professional legal counsel. The legal information provided in this webinar is general and should not be relied on as legal advice, which Critchfield and Johnston LTD attorneys cannot provide without full consideration of all relevant information relating to one's individual situation. My name is Imani Fields, and I'll be moderating today's presentation. Before we get started, there's a few housekeeping items to cover. First, if you have any questions during today's presentation, you may enter them into the chat box on your screen. We will try to answer as many questions as we can at the conclusion of today's presentation. However, to be respectful of your time, we know that we will not be able to get to them all. Therefore, following today's webinar, we will review all questions and send out the answers via email as soon as we can. When you receive this email, you'll also receive the recording of today's presentation, as well as a link to participate in a very short evaluation. Please take a few minutes to share your thoughts about the presentation as a whole, the information provided, and our presenters. Your feedback is important to us as we determine future webinar topics. And right now, GoToWebinar is having a little difficulty putting up the presentation, so you all will receive a copy of today's slides after the presentation. Now I will introduce today's presenters, Renee West and Kimberly Hall. Renee West is a senior manager and leader of Rea Associates HR consulting practice. With more than 27 years of experience in human resources, Renee specializes in assisting organizations within the manufacturing, nonprofit, contingent staffing, food, and other industries with their HR challenges. She is also currently serving on the Ohio Society of Human Resources Management Board of Directors as Central District Director. Kim practices in Critchfield and Johnston's Employment Law Group. She focuses her practice on counseling employers in employment law matters and regularly assists employers in complying with the Fair Labor Standards Act, the Family and Medical Leave Act, the Americans with Disabilities Act, and its amendments, the Age Discrimination in Employment Act, and more. She defends employers against employment lawsuits that include claims of wrongful discharge, discrimination, hostile work environment, and harassment, and many more things. And today I'm going to introduce the presentation. So I believe, Renee, you're taking it away, right?
Great. Good morning, everyone. Thank you, Imani. Thank you, Kim, for joining us on our presentation today as well. Welcome, everyone. It is hard to believe that a year and a half later, we're still talking about COVID. But one of our goals is to be sure that we're sharing what we know from a resource perspective for you, from an employer perspective, ensuring that you're compliant and also in the know of any, pending upcoming changes as it relates to COVID and the safety in your workplace. So we're going to go through our agenda here. Next slide, please. So as we continue to talk, we're going to talk a little bit about the new concerns that are coming out with the Delta variant. Also talking through with you, should you have a positive case in your organization, reminder of what the process should be. Also looking again at the quarantine guidelines as it relates to both vaccinated and non-vaccinated people. Also touching base on the current FFCRA leave and just talking in general about what we're hearing as some possible movements in relationship to COVID. Again, keeping up on CDC and statewide resources. We don't have all the answers, but we will share what we do know and keep you updated as this continues to progress. And Kim will talk through from a legal perspective, talking through vaccine policies, requirements, mask issues, everything to keep you compliant from a legal perspective as well. Next slide, please. And we'll also be talking about best practices for you and also what should employers be prepared for as we move forward. So that's a lot of information. Again, we will be sharing slides with you at the end of the presentation. And please, if you do have questions, we're happy to address those at the end. I'm sure everyone is aware of in the news and the concern now with the Delta variant that is growing throughout the United States and other countries. We are concerned from a safety perspective. Employers were receiving a lot of questions as your employees are starting to now wonder, okay, what is my employer doing? What should we be watching out for? We've included a link here that was actually in the news earlier this week that is a COVID data tracker, and it shows the current exposure rate of this new Delta variant in the United States. And you can click that link and also drill down to it from a statewide level. But I believe our next slide actually shows what this data tracker is showing as all those areas that have high transmission rates of this particular variant. So obviously that's definitely a concern and one that a lot of news and people are talking about. So next slide, please. So we've talked with a lot of employers and clients about we're starting to see another influx of individuals having positive COVID cases. And, we had a lull there for a while where things were, pretty normal and didn't have a lot of incidents. So now that we're starting to see some of this pop back up again, one of the biggest things is talking with your employees and sharing, safety information as we're sharing here today. Yes, we're all tired of talking about it and dealing with it, but we also need to be aware that your employees are concerned for themselves and their families as well, and are looking to you, the employer, as to what are you doing to keep me safe in the workplace. So quarantine guidelines have changed since our earlier seminars, and it varies based on whether you're vaccinated or non-vaccinated. So we're going to talk a little bit about what the CDC guidelines are for that, as that's where a lot of the questions are coming from. And what should you continue to do as an employer if your employees do test positive for COVID? Next slide, please. So one of the questions that I've received a lot over the last couple months is we're having employees that have positive cases. If we're deemed an essential employer, do we need to deal with COVID? Can we just pretend like it's not there? That would be a nice thing to do, but unfortunately, that's not what we recommend. Even if an employee, does come down with COVID, you as the employer are still required to follow the established protocols and address that. Even if you're deemed an essential employer, that obviously is important, but it's for every employee. So that's definitely something to keep in mind. Next slide, please. So when we talk about quarantine, you have the question of when are we supposed to quarantine? What should a person do? What if an employee calls and says, I've been exposed? The guidelines still remain the same from a quarantine perspective of the definition of close contact. So close contact, again, within 6 feet of someone for a total of 15 minutes or more over a 24-hour period. And it also goes through and talks about now, if you have COVID or are diagnosed with COVID, it's important that if you've had the vaccine too, that does change the quarantine. So people who are fully vaccinated do not need to get quarantine after contact with someone that has COVID-19 unless they have symptoms. Now, keep in mind, everything that we're talking about today could possibly change as we move forward, but this is where it is at this point. So again, that's important that if you have employees that are vaccinated or if you yourself are vaccinated, there is no need to quarantine unless you have symptoms. Best practices, if you do have symptoms, reach out to your health department, reach out to your doctor, be sure that you are talking with them, because as you're hearing in the news, we are seeing some people that have had vaccines that are coming down with the variant. So important to keep that in mind. It also talks through fully vaccinated people should get tested 3 to 5 days after their exposure, even if you don't feel that you have any symptoms. So again, just a best practice to follow to continue to keep yourself safe. Next slide, please. So I've had clients say, okay, so what are we supposed to tell our employees if they're sick? if they have COVID or they're exposed. So again, stay home for 14 days after your last contact with a person. Watch for the fever, watch for the other symptoms. And again, we have links here that will take you to the CDC website. If possible, stay away from people that you live with. And of course, again, keeping those that are at high risk away as well. Next slide, please. There are abilities to shorten that quarantine time frame. So again, we traditionally have said 14 days. Your local health department also can share details that there is a way to decrease that time. So if you say, for example, after 7 days of receiving a negative test, you are permitted to return. It's important that you must be sure that you continue to watch your symptoms, and should you exhibit any symptoms, that you return back to your doctor. So again, please refer back to the CDC guidelines and the CDC website, as all of this is outlined specific for quarantine versus, specific for vaccinated versus non-vaccinated. Next slide. So one of the items that we do want to talk about, and we are still receiving a lot of questions about, is in reference to the FFCRA, which is the Families First Coronavirus Response Act, actually that has been extended through September 30th of this year. And this is just a reminder, again, this is voluntary for employers to provide this paid leave time to their employees based on them meeting the criteria as outlined in the Act. It is important also to keep in mind that the leave has been, the criteria for leave eligibility has been expanded to include anyone that is having an adverse reaction from the COVID-19 vaccine. That's also covered time as well. So it's important for those employers that are continuing to offer this, that they're consistent in their process as they move forward and ensure that they are documenting and providing details as to who is receiving this pay. Next slide, please. And this is the bottom part of the slide that also talks through for the FFCRA leave for the daycare, and leave in reference to if a child's daycare is closed. Schools are going to be starting up soon. Daycares are going to be, continuing to have more students. So again, this is part of that FFCRA leave eligibility. Next slide. So what we do want to be sure employers know, those that are participating in the FFCRA leave, the relief bill still allows for payroll tax credits for any wages that you're paying for those employees on FFCRA leave through September 30th of this year. I've had the question, do you think it's going to be extended? Do you feel, and again, we're waiting to hear, whether or not this leave will be extended from the federal level. That will be something that I'm sure they'll be evaluating here over the next month. Given the current state and seeing the increase in the cases, there's probably a good chance that there could be an extension of this as well. And we'll of course keep you updated should there be any changes on this. Next slide, please. A lot of employers are asking too, what are our options? Again, this is a voluntary benefit for your employees. We are, talking with organizations and hearing that there is the concern that, we want to also retain our people, and should there be, an influx of cases, we also want to, be able to help our employees by extending this leave. So a lot of companies are, continuing to want to offer this FFCRA leave and thinking about how to retain their workforce and keep their employees safe as well. And the biggest piece too is documenting who is receiving this type of leave, and that way when it comes time for reporting for the payroll tax credit, that you have that information readily available to report. Next slide, please. So I've heard a lot of people, and I know myself, we're asking, what should employers be prepared for? You hear the news, you hear what's going on, and you just wonder, what really should we be doing? And I always like to look at the positive side of things, and, telling clients and telling organizations that, many employers are in a better spot this year versus where we were in March of 2020. Majority of policies, best practices, social distancing guidelines have all been put in place earlier. So should there be an event where there needs to be more mask mandates or more social distancing guidelines, a lot of employers can just revisit what they had previously done and not have to reinvent the wheel, so to speak. So that is a good thing. And I think too, employers also need to be aware, as employees are, possibly becoming concerned about the workplace, be prepared for requests for remote work, and explore, reasonable accommodations. And Kim will be talking about that as well in her section. Next slide, please. And as we talked about, potential extension of the FFCRA leave, again, that's September 30th. So, we'll be keeping an eye on that to see if in fact that does extend. Also, as we talked about before, things are changing on a daily basis. So, the potential for additional mask mandates based on, governor's orders, possible, revisiting of social distancing guidelines. And it's just, there's a lot that we don't know at this point, but also know that we just need to keep our ears to the ground and be able to share resources as we have them, and share those with your employees as well. Again, communication back to the employees of the safety is your primary concern. Some individuals, might have questions, might have, still a concern. So, we're telling employers still treat this as a very, valid concern, and be aware and be prepared. So stay tuned for further details. And, one of the biggest things too that we're talking about is employee handbooks and policies. A lot of organizations from the earlier pandemic have looked at their policies and procedures and updated their ADA, their family medical leave, their leave of absence policies. They've looked at implementing remote workplace policies and hybrid work schedules. So if you have not looked at your employee handbook, it is definitely a time to be able to do that. It's very important, as there have been a lot of changes over the last year, but it's also important that these policies are updated to go hand in hand with the ever-changing regulations as well. Next slide. And I'm going to turn it over to Kim for her to share the legal perspective, and your turn. Thanks.
All right. Thank you, Renee. So good morning, everybody. Like Renee said, it's kind of wild that we're still here talking about COVID-19, but we just wanted to give a little refresher on some information we had previously conveyed at other webinars, as well as updates we have some best practices for employers and what the legal framework looks like right now for employers in COVID-19. Next slide. So I am going to cover two topics that are sometimes controversial in the media, but that's based on people's personal perspectives. I'm here to go over the legal framework and what employers are and are not legally required to do, and what the legal risks are when you're not following federal and state guidance. So the first topic is masks. I'm going to address whether Ohio employers are required to mandate that unvaccinated employees wear masks, and whether employers are at risk if they do not follow federal CDC and/or Osha guidance. I'm then going to discuss the issue of vaccines and whether it is legal for employers to mandate that employees receive the COVID-19 vaccine as a condition of employment. What are the legal limitations on mandatory vaccine policies when it comes to private employers? And what alternatives are there to mandatory vaccine policies if employers aren't prepared to take that step to mandate the vaccine for their workforce? Next slide. So starting with the issue of masks, currently Ohio does not have a statewide mask mandate. That was lifted some time ago, so there's no Ohio Department of Health order that is mandating people wear masks in the workplace like we were accustomed to for a great period of time. Similarly, when we look to the federal level, we have the CDC guidance. It's not a legal requirement. It's not codified in the Code of Federal Regulations or the United States Code. We also have Osha guidance. Again, this is not rules or regulations, except in the healthcare context, there are some rules and regulations. But for most employers, we just have federal guidance in place. Again, if you are in a particular local area where the local health department is mandating certain requirements, you're going to need to comply with the local rules. And also, if you're not in Ohio, if you're in a different state, there can be statewide mask mandates that would be in place. So for the purposes of today's discussion, we're looking at this from the perspective of an employer located in Ohio. Next slide. So the CDC guidance, in May, the CDC said it was generally safe for fully vaccinated individuals to go maskless. That was big news, and it was a great relief for a lot of people who were tired of wearing masks for such a long period of time throughout the pandemic. However, the CDC is sort of going a little bit backwards from that guidance. Recently, it issued updated guidance. That guidance was issued on July 27th of 2021. The CDC added a recommendation for fully vaccinated people to still wear a mask in public indoor settings in area of substantial or high transmission. The CDC website has an interactive map showing areas of substantial and high transmission, and that's the map that Renee was going over earlier that showed the red areas, the tan areas, and you can go from the state level as well as down to the county level to see what areas of high or substantial transmission are. As of the other day, August 3rd, when I checked the map, Wayne County, Ohio is designated as an area of substantial transmission. So for folks who are living in Wayne County, like I am, technically the CDC is recommending that even if you're fully vaccinated, that you wear a mask in indoor public settings, which might be a surprise to some people because it's sort of reverse course from what the CDC was saying previously back in May. Next slide. As for the OSHA guidance, the quote at the beginning of this slide is from OSHA's website, and OSHA has a pretty user-friendly website where you can check for periodic updates as to what their guidance of the day says. As Renee touched on earlier, guidance can change pretty frequently from day to day, so it's important to continue checking the CDC website, the OSHA website, to get the most updated guidance. But OSHA is saying that the recommendations are just advisory in nature and informational in content, and are intended to assist employers in providing a safe and healthful workplace free from recognized hazards that are causing or likely to cause death or serious physical harm. So OSHA is making clear that this is just informational guidance. It's not rules or regulations that employers are mandated to comply with. Again, outside of the healthcare context, there are rules and regulations there, which goes to the second point below. OSHA goes on to state that except for workplace settings covered by OSHA's emergency temporary standards and mask requirements for public transportation, most employers no longer need to take steps to protect their workers from COVID-19 exposure in any workplace or well-defined portions of a workplace where all employees are vaccinated. Employers should still take steps to protect unvaccinated or otherwise at-risk workers in their workplaces or well-defined portions of workplaces. Next slide. So OSHA has a lot of guidance on its website. They have like a drop-down menu where you can see what the current guidance is for employers. I'm not going to go through every single one of these points. I just wanted to highlight that in OSHA's guidance, they are telling employers that employers may want to suggest that unvaccinated customers, visitors, or guests wear face coverings. So again, OSHA isn't saying you must require everybody to wear a face mask, but OSHA certainly is suggesting that you do that. Next slide. So are employers required to follow guidance? The CDC just has guidance, the OSHA just has guidance. Are employers mandated to follow that, and will they be locked up with the key thrown away if they don't follow the guidance? So guidance is not the same as a law or regulation, so you're not going to see yourself with a violation of OSHA or another federal law just by not following those specific pieces of guidance. However, OSHA does remind us clearly on their website about face coverings that OSHA's general duty clause, which is section 5A1, does require employers to provide their workers with a safe and healthful workplace free from recognized hazards that are causing or likely to cause death or serious physical harm. Now that is a law, a regulation that employers are required to follow. So by following the CDC and OSHA guidance, employers are showing that they are complying with the general duty clause, which they are at all times required to comply with. And following that guidance is just going to help you ensure a safe workplace for your employees. Next slide. So are there risks in not following guidance, even though the guidance is not actual law? We're in a gray area. We haven't really seen a lot of lawsuits or claims fully develop or get ruled on at this point, but there is a possible risk if you're not following the CDC or OSHA guidance. High-risk employees can be in your workforce, and you might not be aware of who is high risk and who might not be able to get a vaccine due to being high risk. And you never know when somebody might get seriously sick by you having lax mask enforcement in place. That could potentially give you increased exposure to workers' compensation claims. If somebody contracts COVID-19 during the course and scope of their employment, and they're able to tie it to having contracted it at work, then you could potentially have a pretty expensive workers' compensation claim on your hands. Another question is, if you're not following federal guidance on masking, are you potentially exposing yourself to a negligence claim by customers who are entering your premises? Are you falling below the standard of care that you're required to provide to your customers and your employees? A third piece, which I see as quite likely to pop up, just because we have seen this pop up with other employee safety concerns, is the risk of unemployment claims. If employees argue they had just cause for resigning from their employment due to safety concerns. Where we could see this come up is if an employee is an at-risk employee and they want their coworkers who are unvaccinated to continue to wear a mask, and the employer is not willing to enforce the mask guidance that CDC and OSHA has put in place, that employee does not feel safe to continue working and they resign their employment and file an unemployment claim, there's a risk that the employer might lose that unemployment claim because the employee might have just cause for having resigned their employment. We've seen employee concerns about safety lead to a lot of unemployment disputes throughout the pandemic. For example, if employees felt that the employer didn't put enough safety precautions in place, for example, no hand sanitizer, no PPE, and the employee raised the issues with the employer didn't address it, the employee quits, then there's an employment dispute there that the employer is at risk of losing. And with each of these three potential exposure areas I just went over, you're at higher risk as an employer if you not only don't enforce or implement the CDC or Osha guidance, but you go the step farther of having a formal policy to employees that nobody is required to wear masks regardless of their vaccination status, because now you have a written document that can be used as evidence against you as an employer if one of these three issues happens to pop up. So that's certainly something to keep in mind. Next slide. So the best practice with respect to masks is to continue following CDC and Osha guidance. Check the website frequently to see what the current guidance is, because it changes quite frequently. You want to stay on top of that. Again, simply complying with the CDC and Osha guidance is easier said than done. One, because it's changing so frequently and your head can be spinning sometimes trying to stay on top of it and then also run your business at the same time. But also you have the employee relations issues. As I mentioned at the beginning of my piece, this tends to be a pretty controversial issue in the media. People have very strong feelings about both masks and vaccines one way or another. So regardless of what you do as an employer, you're probably going to have some folks who are unhappy with the decisions you're making. So from a legal perspective, best practice, follow CDC and Osha guidance, but from an employee relations perspective, there's some nuances there that you're going to have to address depending on the who is in your workforce and how you think they're going to react to what policies you put in place. Next slide. So the second piece we're going to go over today is the question of mandatory vaccine policies. Recently, we've seen in the news that some pretty large employers have gone the route of deciding to mandate that their workforce get the COVID-19 vaccine as a condition of employment. Some very large employers are, we've seen in the news, I'm trying to think of one of the employers that has done this. It can't come to my mind right now, but they've decided to mandate vaccines for their corporate workforce, but not for people just working in their shops throughout the company. So employers are approaching this issue differently, but the question becomes, is it even legal for employers to mandate vaccines for their workforce? And the answer is yes, employers are legally permitted to require that their employees get vaccinated as a condition of employment. However, there's some very important exceptions, and that would be exceptions for disabilities and religious beliefs. And third consideration is the employee relations issue, just with masking policies. How are your employees going to react if you require vaccines? Are you going to have a workforce where everybody quits? Are people going to be receptive to the idea of mandatory vaccines? You know your workforce better than anybody else, so you need to consider what is going to be the practical effect if I implement a mandatory vaccine policy. Some states more recently have been considering legislation that would prevent employers from requiring their employees to be vaccinated. Currently, as of today, there's no such law in Ohio that has passed, but we're keeping tabs on that. Next slide. So if you're going to mandate or consider mandating a vaccination of your employees, your workforce, you need to consider the Americans with Disabilities Act and also Title VII of the Civil Rights Act of 1964. The EEOC has great guidance up on its website. And according to the EEOC, the EEO laws, including the ADA, continue to apply during the time of COVID-19, but they do not prevent employers from following the guidelines made by the CDC or state and local public health authorities about steps employers should be taking regarding COVID-19. Guidance from public health authorities is likely to change as the COVID-19 pandemic evolves. So like I mentioned a couple times throughout today, employers should continue following the most current information on maintaining workplace safety. Next slide. So if you're going to decide to put a mandatory vaccination policy in place, you are going to have to consider accommodation requests both under the ADA and under Title VII of the Civil Rights Act. The ADA, you're going to have to consider accommodations or exceptions to the vaccine policy due to an employee's disability. And then under Title VII, you're going to have to consider exceptions or accommodations to the policy due to an employee's sincerely held religious beliefs. Next slide. So under the ADA, the accommodation process is the same accommodation process HR folks are using for employees in the normal day-to-day life of a business before the COVID-19 pandemic happened. So as we're all familiar with, the process is an interactive process. So the way it would work is an employee requests an exemption to the vaccine mandate that the employer has put in place due to that employee's disability. The employer and the employee engage in the interactive process, trying to determine if there is an accommodation that is available to the employee that won't impose an undue hardship on the employer. And an undue hardship is defined as a significant difficulty or expense. Next slide. In going through this process, a couple points for the employer to consider. What is the amount of how many employees in your workforce have actually been vaccinated? Are people, for the most part, fully vaccinated? Are there only a few people who have been vaccinated? A second point, how much contact does that unvaccinated employee have with others, with coworkers, with the public, with vendors? And you're also going to want to consider the unvaccinated employee's position, job duties, what they do day to day as part of their essential job functions. Next slide. And then at the end of the process, you're going to decide what accommodation, if any, is the employer going to be able to provide to this employee. Some possible accommodations to a mandatory vaccine policy for a disabled employee would be to provide additional PPE to that employee, or to allow that employee to work remotely for a period of time. Next slide. And managers and supervisors responsible for communicating with employees about compliance with the employer's vaccination requirement should know how to recognize an accommodation request from an employee with a disability and know to whom the request should be referred for consideration. We don't want accommodation requests to fall through the cracks because it's not clear who should be processing those accommodation requests. And also it's important to keep in mind that an employee does not need to use the magic words, I am requesting an accommodation for a disability, in order for that interactive process to be triggered. Next slide. I think we went backwards one. Okay, thank you. And importantly, the employer cannot disclose that an employee is receiving a reasonable accommodation, and an employer cannot retaliate against an employee for requesting an accommodation. These are the same rules that applied before the pandemic. They'll continue to apply after the pandemic. So if you, as an employer, have engaged in the interactive process with an employee who has a disability, and it is determined that the reasonable accommodation would be to allow that employee to work from home for a certain period of time, if you have coworkers coming up to you saying, why does Jane Smith get to work from home and I don't get to, your response is not going to be, well, Jane has a medical condition and we're letting her work from home. That's not appropriate. The appropriate response, even though it might seem a little vague and cryptic, is we're complying with our obligations as employers, and we can't discuss the matter farther. So not disclosing the fact that somebody has requested accommodation or is receiving an accommodation is important. Next slide. So the ADA requires employers to keep any employee medical information obtained in the course of the vaccination program confidential. And that is the same rule that applies to both before the pandemic and after the pandemic with respect to employee medical information that needs to be kept confidential. You can't be sharing that with others. Next slide. Question, is asking or requiring an employee to show proof of receipt of a COVID-19 vaccination a disability-related inquiry restricted by the ADA? And we have a quick poll here for you to take a vote to see if you think yes or if you think no. Okay, and the answer to that question, you guys got it correct, it's no. Next slide. No, simply requesting proof of receipt of a COVID-19 vaccination is not likely to elicit information about a disability and therefore is not a disability-related inquiry. However, if you go with this step further and ask somebody why they did not receive a vaccination, that might elicit information about a disability and would therefore be subject to the ADA standard that the inquiry be job related and consistent with business necessity. So in order to keep out of some difficulties with the ADA, you as the employer should probably keep your inquiries to, are you vaccinated, are you not vaccinated, and not getting into the details of why somebody may or may not be vaccinated. If an employer requires employees to provide proof that they have received a COVID-19 vaccination from a pharmacy or their own healthcare provider, employers should be notifying employees. Employees do not provide any medical information as part of the proof. Just provide us the simple proof, have you been vaccinated or not been vaccinated, because you don't want to see an employee's medical diagnoses or medical history as part of that proof. Next slide. So moving on to the religious accommodation process, we just went over the disability accommodation process. The accommodation process for religious beliefs, if somebody is asking for an exception or a modification to the mandatory vaccine policy, if you do put the mandatory vaccine policy in place, very similar to the ADA process, the way it would work would be the employee would indicate he or she is unable to receive a COVID-19 vaccine because of a sincerely held religious practice or belief. At that point, the employer and employee would engage in the interactive process and would need to decide if there is a reasonable accommodation that's available that does not pose an undue hardship on the employer. And here, undue hardship in the context of religious accommodations is more than a de minimis cost or burden on the employer. Next slide. So what qualifies as a religious belief under Title VII that may entitle an employee to an exemption to a mandatory COVID vaccination policy? So a religious belief is very broadly defined. The EEOC guidance explains that because the definition of religion is broad and protects beliefs, practices, and observances with which the employer may be unfamiliar, the employer should ordinarily assume that an employee's request for religious accommodation is based on a sincerely held religious belief. If, however, an employee requests a religious accommodation and an employer has an objective basis for questioning either the religious nature or the sincerity of a particular belief, practice, or observance, the employer would be justified in requesting additional supporting information. You should be doing that sparingly. Again, in the United States, we have a wide variety of religious beliefs. So if somebody seems to have a sincerely held religious belief, you should probably go with what they're telling you. Next slide. Importantly, however, what does not qualify as a sincerely held religious belief is social, political, economic philosophies, or personal preferences. So somebody simply saying, I am opposed to the COVID-19 vaccine because I think it's a dumb idea, that is not a religious belief that's going to entitle them to an exemption under Title VII. Next slide. So what happens if an employer cannot exempt or provide a reasonable accommodation to an employee who cannot comply with a mandatory vaccine policy because of a disability or sincerely held religious practice or belief? If an employee cannot get vaccinated for COVID-19 because of the disability or sincerely held religious belief, and there is no reasonable accommodation that is possible, then it would be lawful for the employer to exclude the employee from the workplace. This, however, does not mean that the employer may automatically terminate the worker. Employers should first consult with legal counsel. This is a very touchy process, and it should be a pretty lengthy process before you get to the point of deciding that termination is the best way to go. Next step. I think we went backwards. Okay, so if you as an employer are not prepared to implement a mandatory COVID-19 vaccine policy for your employees for any variety of reasons, what are some alternatives to a mandatory vaccine policy? One, you could simply encourage your employees to get vaccinated. Come out with a statement saying it's the company's belief that the COVID-19 vaccine is a good thing and it keeps people safe, and employees can do with it what they want. A second option is you can provide incentives to employees to get the vaccine. For example, maybe you provide them with some additional PTO for time to them to go out and get the vaccine. Maybe you provide them with a small cash bonus. But if you're providing employees with anything substantial, like a substantial benefit, then you may need to offer an alternative program for folks to take advantage of who have a disability or religious belief that doesn't allow them to get vaccinated. For example, you might allow folks who have a disability or religious belief that prevents them from getting vaccinated, participate in an educational program where they would be able to get that cash bonus or additional PTO if they're not able to get vaccinated. Next slide. So the best practices with respect to vaccination policies is first, have a written policy in place. Notifying employees if it is a mandatory policy, a voluntary policy, an incentive-based policy. Employees want to have some certainty as to where the company stands on this pretty important issue. Clearly identify to employees how they can request a accommodation due to a religious belief or due to a disability. Make sure you have a process in place where you can maintain the confidentiality of vaccine records. And also, very importantly, if you have unionized employees, you need to consult the collective bargaining agreement, because that's going to affect how you analyze the entire situation of what can we do and what can't we do when it comes to mandatory vaccines. Next slide. Okay, well, I think that was the end of my piece. I think we'll take some questions now.
Awesome. And if you guys have any more questions, be sure to put them in the question pane. It looks like for the first question here, it's asking for a little bit of clarification. It says the mask issue is confusing. Should our employees be wearing masks if they are vaccinated? And I guess I'll add on to that and say, can we require our employees to wear a mask even if they're vaccinated?
So as a private employer, you are able to go above and beyond what the CDC is recommending. So yes, you can require your entire workforce to wear masks inside if you want them to. But you will need to consider possible accommodations due to a disability. For example, if an employee is unable to wear a normal face mask because of a breathing condition, you're going to need to consider, you're going to have to go through the interactive process before you determine if you can exclude that employee from the workplace or what your next steps are going to be. But generally speaking, aside from disability accommodation issues, you can mandate that your entire workforce continue to wear masks, whether vaccinated or unvaccinated. As for what the requirement is right now, as I mentioned at the beginning of the presentation, we are just, for employers in Ohio who don't have any local rules or regulations that state otherwise, the current policy is there's only guidance in place. There's no mandate. You're not mandated to require unvaccinated or vaccinated employees to wear a mask. But the CDC is saying if you're in an area of high or substantial transmission, where you can see on the CDC's interactive map, then you should be asking folks who are inside in indoor common public areas to wear a mask, whether you're vaccinated or unvaccinated.
Great. Anything you might want to add to that, Renee?
No, Kim covered all the pieces there.
All righty. So just kind of adding on to that question, we got another question here. It says, can we require an employee to get a COVID test?
I guess that depends on a number of different things. Does the employer have reason to suspect that there was a COVID-19 exposure? Is this employee working around coworkers and the public at large where there is a potential safety risk at issue? There's a number of different factors that would affect our analysis here. But if somebody is sick and coughing at work, what you'll want to do is send them home from work, and they'll follow the CDC's recommended guidelines for returning from quarantine. And as Renee touched on earlier, if they can go out and get a test, then that's going to shorten the amount of time that they have to be in quarantine. So you may not even have to get to the point of requiring an employee to get a vaccine, I mean a COVID test. The shortened quarantine period, when you do get tested, could be incentive enough for that employee to go out and get the test done. So there's no black and white answer to the question. It depends on, is this employee exposed? Is there a safety risk? Where is the employee working? Who is the employee working around? So it's not as straightforward as we would hope it would be.
Great. The next question we have here is, can you define or describe a sincerely held religious belief? I believe that was something that was on one of your presentations, Kim.
Mm-hmm. So a sincerely held religious belief, that is very broadly defined. That pretty much includes all the very mainstream religions we can think of, Christianity, Judaism, Catholicism, Islam, but also religions that we might completely be unfamiliar with and not aware of what the actual tenets of that religion are. But the way you would want to think through this is a person expressing a simply political belief? Is this just a personal belief? You can ask them for additional details, okay, about the nature of their sincerely held religious belief, but you'll want to err on the side of allowing or considering the belief to be religious if it doesn't seem to be tied to just politics or personal preferences. So there's, again, no clear answer here, but err on the side of caution just because you're not completely familiar with what all the religions in the United States might be. There's very small ones that you might have no familiarity with, and the employee that has that religious belief is entitled to protections.
Great. The next question we have here is, how can OSHA's general duty clause be used with COVID? The clause says likely to cause death or physical harm. Likely doesn't fit a definition within COVID's greater than 99% recovery rate.
Yeah, so that's a great question, and it's not clear how the general duty clause has been used by OSHA, to what extent OSHA has been using it to either cite or not cite employers for safety violations concerning COVID-19. However, it is still a best practice to follow OSHA's own guidance when you're trying to protect your workforce, because you're putting yourself in a sort of difficult position if OSHA comes knocking and says, we received a complaint from an employee. This employee says the company has a policy of nobody wearing masks at work, regardless of vaccination status. What is your response? And you don't want to be in the difficult situation of saying, oh, we decided to defy OSHA guidance because generally speaking, or statistically speaking, COVID-19 might have a high survival rate, but when you're looking at the specific facts of your workforce, maybe you have a lot of people who are high risk for COVID-19, and that survival rate might be significantly less. And so OSHA might think, okay, given the nature of your workforce, given that there were a number of safety concerns raised by disabled employees who could have a pretty high sickness or death rate from COVID-19, we think you violated OSHA's general duty clause here. So again, it depends on the specific facts of the case, but the best practice would be to comply with the OSHA guidance.
Great. We have a lot more questions here, and of course, we only have 3 minutes left of the presentation. We're going to get through whatever we can, and whatever we can't, we will be sure to reach out to you guys afterwards. So the next question we have here is, can employers require the same provisions for agency temporary employees as their own employees without risking the employer relationship?
Could you say that question again? I'm not sure I understood.
Sure. It says, can employers require the same provisions for agency temporary employees as their own employees, so doing the same requirements and provisions as their own employees without risking the employer relationship? Not too much more clarification outside of that.
Okay, it sounds like maybe the question is with regard to employees placed with your company by temp agencies. The first place you'll want to look whenever there's a question of temporary employees is your contract with the temp agency. What does that say about who is able to implement policies concerning employee safety, who's in charge of what? So the first place you'll want to look is at your contract with the temp agency to see what your rights and responsibilities are with respect to who is placed temporarily at your workplace.
Great. The next question we have here is, if someone received pay for COVID in 2020, are they eligible for COVID pay again in 2021?
So yes, so thank you for that question. That is a very common question. And as of with the new timeline that started April 1st, yes, they do. Basically, the clock reset and they are eligible for, if they meet the criteria for that eligibility with that FFCRA leave. But it is still just the 80 hours. It is not anything additional. That all remains the same.
Great. And the last question I have here, I'm kind of going to ask you guys to reiterate a couple points and then ask this one. So the first thing is, a lot of people are asking, it is okay to ask their employee about the vaccination status. You can do that, or can you not do that?
Yes, you can do that.
Okay. And so the next question we have here is, can an employer request unvaccinated employees to be tested on a regular basis and provide the test results?
Yes, and we have actually seen that as an option that some larger employers have been implementing, saying, oh, okay, employee, if you don't want to get vaccinated, then the alternative is you're going to have consistent testing that we're going to ask you to undergo. So we've seen that happen with other employers. And so it certainly is an option that you can consider when you're deciding what your vaccine policy is going to be and what the potential alternatives to your vaccine policy might be.
Great. Well, thanks, ladies. We are hitting time right now. If we did not get to your question, we will be sure to reach out after the presentation. Thank you guys for joining us for COVID Crisis 2.0, tips to help businesses address new cases, mask mandates, and vaccine requirements. We hope that Renee and Kim were able to provide you with some valuable insight. If you sign off today and realize you have additional questions, you're always welcome to reach out to our presenters directly or any of our team members. Don't forget to watch your inbox for an evaluation survey, access to the recording of today's webinar, the presentation, and more. Thank you. We hope you have a great day.
Thank you, everyone.